Beyond the Pelvis is hosted by Dr. Kenael a pelvic floor PT and intuitive healer, and Laura Haraka, a somatic practitioner and breathwork facilitator. Each week, we explore alternative and holistic approaches to healing chronic pelvic pain and other painful or chronic conditions. Join us and other experts in mind, body, and spiritual healing as we discuss a wealth of modalities ranging from ancient practices to modern therapies that challenge the conventional Western model of treatment. Let's get right to it.
So welcome back to another episode of Beyond the Pelvis. Today we have the honor of interviewing Dr. Brad Fanestil, who is a board certified in internal medicine and has practiced as both a primary care internist and as a hospitalist for most of his career. In 2017, he began researching and learning about new theories in neuroscience, largely supported by functional MRI data that are beginning to explain the emotional connections between mind and body. After watching many patients improve or resolve their chronic pain problems, he works now at the Center for Mind-Body Medicine, which draws upon these new theories to treat chronic pain and other hard-to-treat medical symptoms without the use of medications. Welcome to the podcast.
Thank you. Great to be here. I love talking about this.
So lovely to have you. And yeah, we would love to talk about all the things as much as we possibly can in the time that we have. But before we jump in, would you mind sharing a little bit about who you are today and how did you get here?
Yeah, I got here, as Laura sort of said, I was a traditional trained in Western medicine. I did residency at UCLA and owned my own practice for 17 years. I was the director of inpatient care at a local hospital. So I did a lot of, in those few years, I only did hospital medicine, a lot of stuff in the ICU. So I come at this from a very Western medicine trained background. And then 6 or 7 years ago, I started reading about the new neuroscience and then applying these ideas to my own patients in my primary care practice with chronic pain. And I had a lot of them and they were getting better. And it was astounding to me at first. And then it kept happening. And eventually, at that time, I was an employed physician with the local hospital. I went to the hospital. I said, I'm going to quit. I'm an old guy. I don't have much hair left. What I do have is white. And I'm going to go do this mind-body thing because it's making a huge difference for a lot of people. And it's really interesting to me. And I'm kind of excited about my job again. But then after a little more discussion with the hospital, there were a lot of doctors in the organization that said, well, we all have people we don't know what to do with. You want to see these people? And so I ended up staying with the hospital for the next 5 years, and we opened a clinic called the Center for Mind-Body Medicine. Now, just recently, I've ended up going out on my own and doing this. So I'm now no longer with the hospital as of 2 weeks ago. And so I've got my own, just a private practice that I do telehealth, and I do in-person visits in Boulder, Colorado, called the Boulder Institute for Mind-Body Medicine.
Congratulations on that.
Yeah, thank you. I'm excited about it. It's actually opening up a lot of doors for me, opening up some opportunities that I kind of didn't have when I was an employee of the hospital.
Yeah, exciting. Starting out on your own then.
Yeah, I've done it before, and it's a little different. I'm an old guy. I'm not putting up with a lot of. Yeah, I've got my own little thing. I'm doing this. I'm seeing one type of person. I tell people I have a hammer. Everything looks like a nail to me now. But when people come to me with pain issues, but my hammer is informed by 30 years of primary care, seeing these people walk into my office every day. And watching them try all sorts of different things, from this supplement to that procedure to that injection to this scope in this orifice to everything you can think of. Sometimes people found some things that helped them around the margins, but this is the first thing I've discovered. The mind-body approach is the first thing I've discovered that actually is a cure for so many people.
So I'm just curious, how do you help them with these mind-body tools that's unique to you?
The first step of this Boy, I can go off on this for hours. But if I try to put it in a framework to help people understand sort of what I'm doing, the first thing I teach most people the tools. I tell people we're going to rewire the neural circuits that are causing chronic pain. I use this for all sorts of other problems besides chronic pain, from irritable bowel syndrome to anxiety, depression. I see all of these now as circuits in the brain. And the good news about that is that circuits can all be changed. It's called neuroplasticity. So I do this mainly in a class that I teach, a 4-session or a 6-session class. I got a couple different classes, just a weekly class, 90 minutes for 4 sessions or 6 sessions, and it's in the chronic pain class. And I tell people you're going to learn how to rewire your brain. So step one for people with any kind of chronic pain is education, just educating yourself about the new neuroscience and help you realize that this is not some woo-woo approach that somebody's making up. The idea that pain is being generated by your brain is not at all woo-woo. It is the new neuroscience. And you can say, well, that's not me, or nah, I don't know, I don't think that's going to work. That's fine. Take a different approach, but you are ignoring the newest neuroscience if you refuse to open your head up to the idea that your own nervous system and your subconscious brain, you're not aware of the part of the brain that's doing this, but that your brain can be doing this. So step one is education for people with chronic pain. And there's a lot of resources that you guys have probably talked about to educate people, and I'm happy to talk about them. But the big step two, I call cognitive reframing. And so cognitive reframe means, what are you telling yourself about your pain? It's not just, do you understand, you've read some books about this. What about you? Does this apply to you? Do these new ideas apply to you? Or are they like, well, maybe a little bit apply to you? So the cognitive reframe about pain is super important, because what you tell yourself impacts how your autonomic nervous system responds to the world. And if you're telling yourself you got a bad back and you've discovered a breathing exercise or some meditation techniques that help it, those are going to be Band-Aids. That's all they are, is Band-Aids. If you're to put on top of your bad back or your damaged nerve in the pelvis, your pudendal nerve or whatever. If that's what you're telling yourself, then all these exercises just become Band-Aids to cover up this thing that at root is broken in you. And so the cognitive reframe is, you're not broken. There's nothing wrong with you. Now, that's can be a nuanced thing to say. I don't mean to say you're not in pain. It's miserable. It sucks. In fact, in the 30 years that I've been practicing medicine, this kind of pain that you could call neuropathic pain, Alan Gordon calls it neuroplastic pain. A lot of people are starting to call it nosoplastic pain. The World Health Organization calls it chronic primary pain. Whatever you want to call it. And by the way, when they call it chronic primary pain, what they're doing is they're saying this is not secondary to something else. The pain is not secondary to a body problem. The pain is the problem. Chronic primary pain is a new diagnosis code in ICD-11 for this. And so this understanding that your pain is coming from your brain and your nervous system is step one. Again, I call that cognitive reframing, just thinking about how your nervous system works and understanding how it works, and then seeing how this is not something that's happening to you because there's anything wrong in the body. The main reason we have this new neuroscience is functional MRI or fMRI. A regular MRI has been around about 30, 35 years. And you take a picture of, say, the brain, and you see the anatomy. You see a stroke, you see a tumor. Functional MRI, fMRI, has been around about 15 years, and we see real-time brain metabolism. So if I got you in the machine and I say, think of what you had for breakfast, certain brain circuits light up. And then while you're in the machine, if I say, now think about the last argument you had with your partner, boom, immediately the picture changes. Now we got some different neurons lighting up. We got the emotional circuits going. So this is not a good imaging tool to make a diagnosis, because what you're daydreaming about the machine, the picture changes. It's a fantastic tool for the neuroscientists, though, to put you in the machine and say, think of this, think of that. Or I'm going to put a hot poker on your arm, see what happens in the brain. Oh, okay. I'm going to put the same hot poker on the other arm. Huh, all right, that changed, but that stayed the same. So it's just given us a whole new framework of understanding pain. And we've stopped talking about any chronic pain that's lasted longer than 6 months as a body problem. Because if your pain's lasted longer than 6 months, we see circuits in the brain, in the emotional centers and the learning centers of the brain that are not present in acute pain. And this is replicable over and over again. So we see the circuits in the brain that light up in people with chronic pain they make no sense for body tissue damage. The old neuroscience was that your body sent your brain a pain signal. The brain said, thank you very much for that pain signal. I'll go get my ibuprofen or my heating pad or whatever. The new neuroscience suggests that, yeah, body sends signals to the brain, but it's the brain that decides, is that signal dangerous? And if your brain decides the signal's dangerous, then the brain warns you by creating pain. So pain's a protective mechanism. If I'm running and I break my ankle, I want pain. I hope I get it. That's a way my brain's protecting me, keeping me off of it, so it will heal. So I now think that all pain is in the brain. And when I say all pain is in the brain, I mean all pain is in the brain. I mean when my hand's on a hot stove, a message goes fingertip, spinal cord, danger alarm center in my subconscious brain. It's always looking out for me. And it says, oh, message like that from the fingertips? That's tissue damage coming my way. I better run an alarm. And my brain runs an alarm called finger pain, meaning it turns on some pain neurons. I take my hand off the stove. Now, that'll happen in a split second outside of my conscious awareness, but it was my brain that made the decision correctly that I was in trouble. It's my brain that made the decision to turn on the pain alarm to get me out of trouble or out of danger. So I now see pain as nothing more than my brain's alarm mechanism to let me know I'm in danger or potential danger. If my brain thinks I'm in danger, it activates certain neural circuits to create for me the experience of pain to get me out of that situation. Most of the chronic pain I see, and oh, by the way, before I go, the anxiety works the same way. Anxiety is a protective mechanism. If I'm in a dark alley at night or I'm running from a lion, I want anxiety. It's called the fight or flight response. I'll run faster. It's really good for me. So we're seeing both pain and anxiety now as protective mechanism, protective messages from the brain to the body to keep it safe. Most of the chronic pain and the chronic anxiety I see is due to what I view as a hypervigilant danger alarm mechanism. I see a hypervigilant danger alarm mechanism all day long in people with a history of childhood trauma, but it doesn't have to be that. Although you can see how if you grew up in a rageaholic house, yeah, you grew up hypervigilant, waiting for the next thing to happen, probably helped you get out of some situations. It can be all sorts of things. It can be just lifetime trauma. It could be, and we're all different. Some people are probably wired a bit more sensitive than others. The world could be a little bit like crazy to them. Maybe they're the black sheep in the family. Nothing terrible happened to them. They're just always a little, maybe they had dyslexia and they went through school kind of going, man, I'm living in a world of cognitive dissonance. Their brain developed a little hypervigilance. And you don't really have to psychoanalyze it either. I'm just pointing out some things that could contribute. I don't think you have to figure that part out. Why it's happening. What you do have to do is recognize this is how brains work. Brains develop neural circuits.
No, you know what? Everything you said is so interesting, but I have a question for you. So
Please.
you talked about pain, finger pain coming from touching a hot stove. And then you also talked about an argument with a partner, spouse, whoever that may be. So I'm just curious what parts of the brain light up when you are under the machine? Is it the same parts of the brain or different parts of the brain?
That is, I'm probably not the person that's going to answer that question. You might want to talk to, mainly because when that comes up for me, I'm like, okay, let's see. We got the posterior cingulate cortex here. Oh, we got the anterior. So we got the prefrontal. And I'm like, yeah, I don't really care about that stuff. So I guess that makes me sound a little less maybe scientific, but I'm like, go ask Yoni Ashar which parts light up, because he will know the answer to that question. And so the neuroscientists who are really working with fMRI certainly look at this over and over again and can answer when you talk about certain parts. There are certain parts, absolutely, that light up, but I'm not going to be the guy who's going to tell you what that is.
So essentially, it sounds like because the response to an acute pain versus a thought about something painful is different. Is that what the functional MRI is showing? Because you're mentioning that like parts that have to do with emotions come up and
Yes, if your pain
yeah.
has gone on more than 6 months, yeah, yeah. So naming these parts, yeah. So the parts of the brain that light up are in the emotional and learning centers of the brain, and we don't see those lighting up in acute pain. We just see these body tissue. You know, there are pain signatures that have been developed on functional MRI. And again, I'm getting to the edge of what I know here as far as the specifics of this. But Tor Wager who's the head of neuroscience at Dartmouth right now, who was also part of the CU back pain study that came out a couple of years ago that sort of was the first big peer-reviewed study, really randomized study showing fMRI changes in patients with chronic pain. And then it showed a reversal of those changes as these people did pain reprocessing therapy and worked with their brain to change their pain. They showed long-term changes in the functional MRI. And I know Tor, who's at Dartmouth, or Yoni Ashar, who's at CU, either one of them, both of them were part of that paper, and they were the fMRI neuroscientists involved with that. And I have no doubt they could tell you, oh, it was this area, that area, and this area, because that was part of their paper. So I don't know if I answered if I answered your question, Kenael.
Yeah, I think you did. I think it's really just understanding that chronic pain is different from acute pain and it can be changed through neuroplasticity. As you mentioned, that's where the repatterning, what did you call it?
Right.
Cognitive reframing
So
comes
the
in.
step one is cognitive reframing because, but that's only step one. The part of the brain that we're talking about here, that I'm talking about, that is a primitive part of your brain. This is the top of your brainstem. Just above that, in the lower parts of your skull, for the most part, the hypothalamus, the hippocampus, the amygdala. These parts of your brain reside mostly in the lower parts of your skull, the lower part of your brain. There are certainly some connections upward. It's not a distinct. We used to talk about lizard brain, and then on top of that was mammal brain, and on top of that was human brain, the old triune brain theory. I like that theory. It's a great way to think about things. The truth is there are a lot more connections between that lizard and the human brain than are accounted for in that theory. But nevertheless, the part of the brain that's running these circuits here is this primitive part of your brain, and it runs your entire body through a network of neurons called the autonomic nervous system. And this is primitive. Every animal on the planet has an autonomic nervous system. It evolved in reptiles hundreds of millions of years ago. I often call it your lizard brain. And it runs everything about you: your heart, your lungs, your bowel, your bladder, your sweat glands, your immune system, your hormones, your inflammatory response. These things don't just happen. There's a conductor. It's in your brain. You just don't have direct access to it. I don't have direct access to mine. And I don't want direct access to it because I don't know how to run my pancreas and my liver. But you cut off the autonomic nervous system from these organs, they don't work right. It's doing this complicated system, and it's super complicated. I often call it's intelligent. It's doing a lot of stuff that I don't even understand. It's not intellectual in the way we usually think of intellect, but it's very intelligent, running my body. And it's making probably thousands, I don't know, millions of decisions per second about my blood oxygen level and how I should breathe and which hormone to release here and which blood vessel to constrict and which one to dilate when I'm sitting in this position. All sorts of things that it's doing moment to moment, making tons of decisions, but it has only one purpose. Only one. Keep the body safe. Keep this organism alive. So it has the same purpose in me as in a lizard. And so I often think of it not just as my lizard brain, but, and here I'm posing like a lizard on the rock, I think of it as my lizard on the rock brain. Am I okay? Do I need to duck under a rock? There is a part of your brain making that calculation every moment of your life. Mine too. That's just how brains work.
So how do you teach that part of your brain that you are safe, that it doesn't need protection?
Yes. So that part of your brain doesn't learn the same as the other brain. Your cognitive brain learns by reading books. But this lower part of your brain doesn't learn by reading books. It's not intellectual. So I like to show people a framework, and I've got a little diagram that I like to show. I think I can explain it, and it will soon be visible on the. I have a TED talk I gave a month ago. It'll be published on the whatever that TED website is in June. It takes them about 3 months to do all the post-production editing, but I show this little diagram in that talk. I guess what I like to do at this point, when people understand that there's part of your brain doing this and running you all the time, is just show you how your brain and body are connected. And so when stress comes in, the autonomic nervous system responds to it. And I'm just talking about the stress of waking up in the morning, just dealing with life, whatever, a phone call you have to make, just routine stuff. I'm not talking about anything major, although this is also true for major things. But when stress comes in, the autonomic nervous system responds to it because it responds to everything. That's its job. And it's primitive. It doesn't understand the difference between physical threat, a lion chasing you, versus existential threat, your rent payment or your relationships. Lizards don't have those things. Lizards don't have relationships. They lay eggs and run away. This is a primitive brain we're dealing with. So when stress comes in, it has one response, which is, we're under threat, I better protect the body. And it sends some protective messages to the body called fight or flight. And this is heart racing, muscles tensing up, maybe gurgly stomach as blood rushes away from the abdomen towards the large muscle groups, which is what happens during fight or flight. All sorts of things happen during fight or flight. But anyway, it sends some sensations to the body. If that's a one-time thing, like a car backfiring, well, you'll calm right back down. But if it's not a one-off, and what I mean by that is if the sensations themselves have caused problems for you in the past, then the negative thoughts follow. Oh no, not that again. Oh man, I got to get up in the morning and now I'm not sleeping. The negative thoughts put more stress on the brain, and it's primitive. It's like, really? We're under more threat? Well, I'm the primitive survival brain. Let me send some more protective alarms to the body. And we get pain signals. We get more tension in the body. We get more whatever our particular problem is. If it's a headache, if it's an interstitial cystitis, if it's a bladder spasm, if it's an irritable bowel, whatever our particular thing is that our brain has gotten into the habit of running. And that feels like crap. And we get even more negative thoughts like, oh man, now what? Am I going to die from this? We get all sorts of stuff. But we get in what I think of as a vicious cycle that I call the pain, fear cycle. What we have here is a brain that is afraid of its own alarm. The alarm of pain or tension comes in and the brain's going, oh crap. What does the brain do that says, oh crap? Just runs more alarm. This is an illogical brain. And it's just trying to protect us with pain signals, with anxiety and tension signals. So how do we get out of this habit loop? Traditionally, once we do the cognitive reframe and we recognize that pain, oh, that's coming from this neural circuit. Anxiety, that's not a chemical imbalance, it's not a genetic problem. Those theories have been so far disproven. They've been disproven over and over again. It's a neural circuit. We can see the circuits. So once you understand these as neural circuits, how do you change those? Traditionally, we say, oh, you got a brain circuit. You should go see a psychologist. Maybe you can figure yourself out, do some psychotherapy, kind of figure out what happened to you and why is it. The problem is these autopilot circuits aren't happening in the thinking part of your brain. Most of my patients are very intelligent. They would have thought their way out of this yesterday if it was happening in the thinking part of their brain. It's happening way down here in the autopilot part of your brain, and you can't psychoanalyze a lizard. So in mind-body medicine, we step away from psychoanalysis. We step away in patients with anxiety. We step away from the story that you and your psychologist maybe or your therapist are trying to create about why you got this way and what's going on with you. For pain, we step away from the story that you and maybe your treating clinicians, your doctor, your whoever, physical therapists have created about why your body won't heal. We step away from those narratives and we go towards the brain circuits, but we don't go towards the thinking brain circuits. We go toward the primitive brain circuits in the autopilot part of our brain. And the way we access those is we pay attention to body sensations. Because when I'm paying close attention to body sensations, I'm now in the language of my autonomic nervous system. The autonomic nervous system is primitive. It doesn't speak English. It speaks one language, body language. That is the language system we have to access if we want to change these autopilot circuits. I'm happy to go
Yeah,
on.
this is all very exciting to me because this is exactly what Laura and I have talked about is the first step is awareness. You have to become aware. And as a physical therapist, that's the first step that I will teach patients and clients is become aware of how your body speaks to you to tell you, I'm not feeling safe. Because once you're aware, now you have choice. Do I continue? So just let it continue in the loop, or am I gonna step out of that loop, right? And I like that you call it a loop as well. It's like this feedback system that is there to protect us, but it's actually making things worse because it doesn't know any better. As you mentioned, its one job is to keep us alive, keep us safe, and it's going to do whatever is necessary, even if it means ruining your life. It's just doing the best it can given what it has, and just being aware is how you step out of that cycle.
Yeah, a couple of things about that, Kenael, that I want to comment on.
Yeah.
One, the habit
Please.
loop. So
Yeah.
I call this a habit loop that the brain gets in. Judd Brewer is an MD, PhD neuroscientist, practicing psychiatrist at Brown University who has an app called Unwinding Anxiety. He's got a couple of other apps
Wow.
anyway.
Love
He's done
that.
a lot of, so he does fMRI research, but he's also a practicing psychiatrist. He talks about anxiety in terms of habit loops. This is a habit loop that brains get in, and brains are really good at forming habit loops. In fact, it's our superpower. Whether you ride a horse or hit a tennis ball, if you do it every day, your brain wires neurons together and you get good at it. If you've been practicing tension, anxiety, pain for months, years, your brain's really good at it. It's like, I got that brain circuit down. So these are just brain circuits. They're neural circuits.
But another thing that I wanted to ask you, being a medical professional, a medical doctor, is sometimes it feels like we bash doctors on this podcast because we're like, doctors don't know, but we're really not doctor bashing people. There are some great doctors out there, such as yourself, and I've met and read about and heard about some really amazing doctors who are doing really great current evidence-based, neuro-based work. My question to you is, what are doctors, some of them, missing if a patient comes to them with chronic pelvic pain and the patient feels dismissed because they're told, oh, it's just in your head, go drink a glass of wine? What are they missing? Like, where could they have taken that to really help that person?
So in the 1600s, Rene Descartes said, I think, therefore I am. And in that famous essay of his, he separated the physical world, which is where he put the human body, from the more ephemeral world of mind and spirit, which he relegated to the church. He's like, we're not going to figure that stuff out. The physical stuff we can figure out. And so in making that, we've been living in this Cartesian dualistic understanding of the world ever since then. Western medicine is firmly entrenched in this dualistic understanding of the world, the mind separate from the body. And I would say Western medicine is severely limited by that old 700-year-old, maybe 800-year-old understanding of how things are put together. We still treat the human being like a car. You're not a car. You have so much more complexity than a car. But Western medicine, we all got trained this way. When there's something wrong, we look for the problem. So Western medicine, or the biomedical approach, takes a very reductionist view of what's going on. And that's its superpower, reductionist thinking. You break down a complex system, the human body, into its constituent parts, and you kind of go, oh, hey, I found a problem over here. And then you fix that problem. That's a fantastic paradigm if you have type 1 diabetes. Type 1 diabetes was 100% fatal until the 1920s. And it was common, just like it is now. We probably all know people who they're 12 years old, or their kid is 12, and their kid at 10 or 9 or 12 or 13, whatever, gets diabetes. Traditionally, it's childhood onset diabetes. It can happen as adults, much more common as a child. Before the discovery of insulin, it killed every single child. And then in the 1920s, Banting and Best in Canada, they won the Nobel Prize for this, discovered insulin. That was done with the scientific method and reductionist thinking, breaking down a complex system. And oh man, there's a pancreas, and the dog has one too. And there's these little beta cells, and there's this insulin. I wonder if we take pancreas or insulin out of a dog pancreas and squirt it into this kid, what will happen? Boom, life got saved. That was the first thing. They took dog insulin and put. I love reductionist thinking. It's super powerful. It's given us not only insulin, it's given us stents in your coronary artery. I would please like that kind of biomedical approach if I'm having a heart attack in the emergency room. Can the cardiologist get in here and open that thing up? It's just that that kind of approach doesn't work for about a third of what walks into a primary care office any day. And a better approach is the biopsychosocial approach. Yeah, we look at the biology, but we also look at the psychology and the social milieu that you're living in or that you grew up in that might have affected brain development. We look at that whole big picture. And that biopsychosocial approach does a much better job of explaining things like chronic pain and anxiety, because they're not due to, oh, you just have an overabundance of serotonin in your nervous system or not enough serotonin or whatever. That's all just a bunch of crap. There are no studies in the scientific literature that say that, for instance, anxiety is due to a chemical imbalance. I want to say that again. There are 0 studies ever. If you find one, send it to me. I promise you, it doesn't exist. There is no chemical imbalance or a blocked neuron or something. That's not what's going on with anxiety, and it's not what's going on with chronic pain either. It's not a damaged nerve. Nerves can get damaged. I don't doubt that. But the pain part of it, and my brain wants to go to 2 different tangents right now, and so I'm gonna give you the opportunity to cut me up for a minute.
Take them. You can take the 2 tangents. Start with one, and we can go with the other. But where are you going with it? Because I'm enjoying where this is going, because I feel like because you are a medical doctor, people are going to listen more. You have that authority, whether you want it or not. You have the white hair, you have the experience, you have the degree. People want to hear it from someone who is in the space to say, no, this is the reality of what it actually is. And this might not be a helpful way of addressing this particular thing. Yeah, that's great. As you said, for diabetes, that works. But for depression, for anxiety, for chronic pain, it doesn't work.
Right.
And I just want to chime in for a moment. Even though I'm telling you, if you have diabetes and you have insulin, you should take it, and your doctor tells you to, but even mind-body tools can help people with diabetes, which I found in Joe Dispenza's study that he has told us about with diabetics when they are split into 2 groups, and one group experiences a boring documentary and another experiences a fun, uplifting show on TV, and then both giving the same meal. Each group, the one with the boring documentary, needed more insulin than the one that watched the fun, joyous show.
Right. Yeah. And to me, that's so obvious. Duh. What do you think's controlling everything in your system? Your brain. And a brain that has an experience of oxytocin release, which is what often happens in a joyous experience or connection with others. Also, I've said forever that the endocrine system, even to endocrinologists, is a black box. We don't understand it. Well, there's a few feedback loops you can draw between the thyroid gland and the hypothalamus, and you can draw some, between the hypothalamus and the pituitary gland, and you can draw these things, but there is so much interrelationship between all these different hormones that are going on, our insulin and our glucagon and our thyroid and our the oxytocin and the norepinephrine. There's a million chemicals, and these things they don't exist. Oh, well, the thyroid exists in this loop and the adrenaline exists in this loop. They all impact each other, and it's so complicated. So the idea that, oh, I have an uplifting experience and something in general, my blood sugar response to food is different. I'm like, duh. I mean, there's all sorts of studies about how, just going back to the digestion issue, there's a hormone called ghrelin, GHRLEIN. And you guys familiar with a study called Mind Over Milkshake? Let me mention. So there's a study where they took a bunch of people and they gave them a chocolate milkshake. And they told one group of people, they said, hey, this chocolate shake, we'd like you to eat it. We want to measure some hormone levels before and after you eat the drink. So ghrelin is a hormone that when you eat, ghrelin makes you hungry. And so, and we can see this all the time. If you haven't eaten for a long time, it goes up in your system, and then it comes down after you eat. So they gave one group this thing. They said, this is a super high caloric drink, but we're just measuring some hormones after. Just enjoy it for this one test that we're doing. We're paying you $50 or whatever, and we're going to draw your blood before and after. But eat this. It's got 600 calories in one milkshake, but it's really good though. So just enjoy it. And the other group gets fed the exact same milkshake, but they're told it's a diet shake. They say it tastes really good, but it's only 110 calories. It's surprising. How good. So yeah, we want to do blood tests before and afterwards. The blood tests are dramatically different before and afterwards. The group that thought they were getting the high fat shake, their ghrelin level disappeared and they weren't hungry. The group that thought they were getting the low fat or the low calorie milkshake, the ghrelin level didn't drop and they remained hungry. It wasn't just they thought they should be hungry. The hormone that causes hunger actually changed in a different way in them. So yeah, our expectations, this is how pain works too. Our pain is a two-way street. Sensory input comes in and then the brain does a whole bunch of stuff with it based on your mood, based on your own expectations, based on perhaps your past history and experiences. So yeah, the brain just reinforces this idea that your brain controls everything. The Joe Dispenza thing, that it changes based on what brain controls everything. So, and by the way, with regard to, you mentioned diabetes, I'm so far down this rabbit hole that I'm like, oh yeah, sure, it could help diabetes. I don't know that I have not seen somebody cure type 1 diabetes using mind-body techniques, and I'd love to. I don't know, but I am so far down this rabbit hole. I'm like, oh, autoimmune disease all day long. What do you think controls the immune system? And that's just based on my own anecdotal evidence with a lot of patients. I don't have a scientific study with autoimmune disease. I hope we will at some point, but.
I love that you're working with autoimmune because I feel like that's a really big thing with women. And I always ask the question, like, why is it that more women experience autoimmune over men? Like, is it social? Is it society? And I don't know, is that even accurate, or am I making that up? Or is it just based on my own population, which my population is biased because I only work with women?
During fight or flight, your immune system activates. And you can measure this. Inflammatory hormones go up when you're anxious. This is your body, this is your brain getting you ready for combat. You might get an infection. You're going to get scratched and your immune system goes up. Your platelets get stickier. These are the blood clotting cells that clot your blood. They're running around your blood. They get stickier during fight or flight because you're about to get in an accident or you get a scratch or a cut and you better clot your blood, which is probably why type A people get more heart attacks. That's like one reason. There's a whole bunch of other reasons probably. But anyway, a lot of very real things happen. So when you ask why is autoimmune disease, why is anxiety worse in women? In the course that I teach, often, not always, it's, it depends on the group and the questions that we're having, but it's not uncommon that I just remember saying this in the course last month at one of the sessions where maybe on the screen I've got, 20 women and 8 men or something like that. We're dealing with their chronic pain or their anxiety, depending on which course it is. But anyway, I remember saying something like, if you're a woman living in this society and you don't have a little more hypervigilance than the average man, there's something wrong with you. This is not a disease. Hypervigilant brain that I'm talking about is not a disease or a disorder. It's a normal brain doing what brains learn to do. Brains develop on something called reward-based learning. They have an experience and then they file that away. They say, oh, that was a good thing to do. The people I see with chronic pain and chronic anxiety, the brain has learned that, yeah, it's good to be a little bit like this. Maybe it's a little, maybe it's a lot. Maybe it was a series of a bunch of experiences during childhood or throughout their life. Or maybe it was one terrible experience, but the brain's like, yeah, I think I'm going to stay like this. It's good for me. Oh, you don't like the way it makes you feel? I don't care. I'm not trying to make you feel good. The brain is not trying to make you feel good. I'm saving your life here. I think I've done a pretty good job. My job is to keep you alive. And I think we needed this back in the day. I think I got you out of some scrapes and I'm just going to stay like this. You don't like it? I don't really care if you don't like it. I'm keeping us alive and I'm doing a good job. We want to retrain this brain. So before I go on with that, because I'm about to launch into something else and I skipped a few tangents, but that's okay. Did that answer your question, Kenael?
Yes, it did. I've heard Dr. Gabor Mate talk about this as well, the autoimmune disorders with women, because we're under more stress, because we are body autonomy. There's laws being made around what we can and cannot do, and it's just more stressful to be
Totally.
a woman during this time. So yes, it makes sense. So yes, it's very aligned.
And so these are overlapping bell curves. It's not like, oh, men have it so good. There's a ton of men who don't have it very good. There's a lot of crap that happened to them, whether it's early in life or continuing to happen. We all have stress. So I want to be careful to not get too much in, and you weren't leading there at all, but I always am careful not to get into the comparison game. We all have this, but on an overlapping bell curve, yes, women in general are more likely to be a little on edge. I mean, it happens on a daily occurrence. When I'm walking down a sidewalk at night, I have a different level of tension than a single woman walking down a sidewalk at night. That's just the fact of our, not just our society, maybe it's just the fact of biology. I don't know. It's just the way it is. So, but again, I just want to go back to the idea that this kind of edginess, or what I call hypervigilance, is not a disorder. And that's part of the cognitive reframe here. I like to tell people, you're not sick. You don't have a disease or a disorder we're trying to fix. You have some brain circuits, and they developed outside of your conscious awareness. And what that means is not your fault. Super important part of getting better. Not your fault. You had nothing to do with this. This is coming from this primitive survival brain that just learned to keep you safe. You didn't make this happen. And you're not going to fix it if you keep blaming yourself. If you keep telling yourself, oh God, what's wrong with me? That's a message of danger to your brain. Your brain's like, I know, there is something wrong with us. It just keeps it in this hypervigilant state. So we have to first accept and understand that these are brain circuits and they developed outside of your conscious awareness. They're not your fault, but there is something you can do about it now that you see, oh, those are brain circuits. And so if I jump into, again, skipping a few tangents that I've written down here, if I jump into what can you do about it? First thing I like to teach people is some very basic body-based messages of safety to the brain. Because I think that chronic pain for most of my patients is all about the fear. Tension comes in and they're like, oh God. We want to get out of that habit loop. And that's an automatic thing. It's an autopilot habit loop. So we want to get it out of that. But again, it's not the thinking brain. So the thinking brain learns by reading books, watching lectures. And that's important because if your captain of the ship doesn't understand this concept, your crew will never get it. So we want to do some education, but that's step one. The intellectual knowledge of, oh, the new neuroscience. Okay, my brain's running circuits. Step one, very important. But now we got to take that message from human brain down to lizard brain. And lizard brain does not learn by reading books or watching lectures. This lower part of my brain that's running my body on autopilot outside of my conscious awareness learns by experience and repetition, which is how my autonomic nervous system got the way mine is and how yours got the way yours is. Lifetime of experience. So we want to start giving it new experiences. Specifically, we want to give it experiences of safety. And more specifically, we want to start giving it the experience of safety in the body. And so a lot of my patients with, especially on the more further end of the PTSD spectrum, have not felt safe in their body forever, their whole life. They don't know what their body feels like it's been acting against them their entire life. So this is not a quick, easy step. Oh, just start feeling safe in your body, but you can practice some super easy ones. So the first super simple body-based message of safety to the brain, I call active mini meditations. The first active mini meditation is called drop your shoulders. And it looks like this. If you were watching me, you would see my shoulders in a sort of normal position, and I just drop them. Now, if you think about what your shoulder blades are doing, and I'm saying this because if you're not watching me, your shoulder blades, when you bring up towards your ears, your shoulder blades go up your rib cage. When you drop them, they come back down your rib cage. So you can also hunch your shoulders, where your shoulder blades move out away from the center and you sort of hunch your shoulders, or you can come back and stand really straight, where I've taken my shoulder blades up against the spine here. And this is called retraction and protraction. Or you can elevate or you can drop. So a little more explanation I usually give, because usually I'm doing this visibly and people watch me. But anyway, drop your shoulders. That's the first active mini meditation. The second active mini meditation is one slow, deep in and out breath through the nose. And it looks/sounds like this. Here's what's happening. If I'm about to be attacked, I've got my hands and my shoulders up and I'm in a protective position, pushing someone away or something. And I would never, boom, drop everything. When I do drop everything, I just sent a message of safety to my brain. And I sent the message in body language. This is the language of the autonomic nervous system. This, with my shoulders down, is a message of safety, because nobody sits like this under threat. When I do a slow, deep in and out breath, my crew brain down here is going, hey guys, the captain of the ship just stepped in, has us doing slow nasal breathing. Everything must be fine, because nobody slow nasal breathes under threat. So these are two body-based messages of safety to the brain. You don't have to understand them. You don't have to think happy thoughts. You don't have to meditate for half an hour, and you don't have to go to nirvana. Just do the damn things. Every time you do them, you activate the vagus nerve. And this is just a fact of how you are constructed. Every time you do a slow, deep, diaphragmatic, abdominal, slow, relaxed breath, you just activated the vagus nerve, which is carrying 75 to 80% of all of your parasympathetic fibers. The parasympathetic nerve fibers are the relaxing part of the autonomic nervous system. And this is just true. It doesn't matter if you want it to activate or not. It's a fact. When you do a slow, deep, relaxed abdominal breath, you triggered the vagus nerve. And when you trigger the vagus nerve, you fire parasympathetic neurons. Neurons that fire together wire together. Nice rhyming phrase, comes from the neuroscientists. They see it happen. So if I drop my shoulders, there's some parasympathetic nerves, and I take a breath, fire a few more, and I do that here and there throughout the day, my brain goes, geez, we keep firing parasympathetic nerve. All right, well, if you're going to fire those all the time, I'm going to start wiring more of those together. You are literally building a stronger parasympathetic nervous system, the relaxing part of the autonomic nervous system, whether you want to or not. So we all live in this balance, sympathetic tone and parasympathetic tone. And these are real nerves. They go to all the parts of every organ in my body. This is not a theoretical construct. You can dissect these nerves out of a cadaver. And these are the nerves that are running your system outside of your conscious awareness. We're all living in that balance. And if you want a stronger parasympathetic, relaxing part of your nervous system, and you do, because everything works better, then you exercise it by doing these simple exercises. I tell people, you can do an active mini meditation. The shrug your shoulders takes 1 second. The breath takes maybe 4 seconds. Try just inserting that into your day. 6, 8, 28 times, doesn't matter how many, just start doing it. You're starting to deliver messages of safety to the brain without any, big work or meditating. I'm a fan of meditation and mindfulness. Everything I do is based in mindfulness. But my point here is that you can do these things very quickly throughout the day. And I'm a huge fan of what Judd Brewer calls short moments many times. Much easier for many people than, okay, I got to do a half hour of this, and I got to make sure I did my 10-minute Calm app in the morning. I think these things are all valuable, and we all have to choose what fits into our life. But these short moments many times are super, super powerful. So I'm a big fan of it. And I have some patients who set an alarm on their phone or something, because they're like, I see that, but I did a deep breath.
Yeah, I'm just going to.
And I felt better. But they forget to do it. So yeah, setting an alarm that goes off every 60 or 90 minutes.
It's so interesting that you say this, because it was one of the ways I got better. I made a conscious effort to drop my shoulders. And I set a cue for myself that every time I walked through a doorway, or every time I ran water. And we run water multiple times a day when we wash our hands, to go to the bathroom, when we do dishes. So setting those two cues, I'd say, oh, drop your shoulders. And I don't know how many times a day I did this, but doing this really can be beneficial to show your body you're safe. So I just wanted to validate what you said, that it actually really works because I did it.
No, fantastic. Yeah, it is. You know, I talk about those simple little things in the first session of every class, and then we get into more, you know, detailed stuff of how to talk to your brain, but or how to deliver messages of safety. But every time by session 2, we've only had one session, and a week later on session 2, and every time several people usually are saying, man, all I'm doing, I think already I'm noticing some things shift around in my nervous system and in my muscle tension. And these people all have just different problems, but yeah, it happens fairly quickly. And many people, if anybody's listening to this and wants to practice this right now, maybe you did with me, I just want to reinforce the idea that one slow, gentle, relaxed breath, many people just with a single breath will notice, I actually felt a little something. Not everybody, something that anybody can start inserting into their day.
I've also seen this as well in my practice because I'm mostly working with individuals with chronic pelvic pain or some kind of abdominal or pelvic dysfunction. I've seen it where I teach it where relax your shoulders, unclench your jaw, relax the pelvic floor so that you can take a full, slow, deep breath in and exhale and just let everything settle. And I have them practice that, you know, because I'm working individually with people. If work is stressful for them, I have them do it before the meeting, after the meeting. If they are driving long commutes, before you get in the car, if you're stopped at a red light, when you get to work, but before you walk into the building, like we have moments that we will incorporate these exercises and they do get better. I think it's one of the reasons why when I work with individuals, I do not see them very often. And that's why I don't think I'm like a regular physical therapist. I don't see people more than even once a week. I probably at the most will see people 2 or 3 times a month. And that's even excessive because it's really just go do these really basic things. And yes, I'm not like do whatever your doctor tells you to do over here, but we're going to keep it really basic. It's noticing, being aware of your triggers and how your body responds to that, and then letting your body know, no, we don't have to overreact for this. It's just traffic. Let's take a deep breath to show your body that you are safe. There is not a tiger behind you.
What I thought of when you were talking there, Kenael, is at its core, mind-body medicine is a form of self-care. I have drugs that rewire the brain, or I have drugs that blunt symptoms. I have no drug that rewires the brain. That's on you. You want to start giving your autonomic nervous system experiences of safety. And they can start with the simple ones, like you just talked about at the red light. But the attitude that you bring to your brain is important when you're doing this. If you stop at a red light and go, oh, God dang it, look at my pelvic floor is all tight again. That's a message of danger to the brain. Even if then you do a relaxation exercise, you're doing it to correct that dang God, what's wrong with me problem. And we want to get away from the idea that there's anything wrong with you. Again, there's so many people who need to hear me say it over and over again. This is not your fault. That this is happening. You have no direct control over this tension, say, in your pelvic floor, or how the autonomic nervous system is affecting your bladder and interstitial cystitis. You know, like all diseases or problems, it exists on a spectrum. Some people severe, some people mild, but interstitial cystitis is often characterized by blood in the urine. And urologists will do, sometimes, if it's bad enough, people have enough problems, a cystoscopy, putting a scope into the bladder. And they often report, wow, it looks really irritated. No, these are real physical changes, but they're not caused by an infection, or the antibiotic would have cured the problem. And a lot of these people have taken antibiotics 28 times, or they get a little better, but not all the way. So these real physical changes are happening because of the nervous system. The bladder is a muscle. It's a smooth tissue, smooth muscle. And when the autonomic nervous system has a ton of control over it. You can override some of that when you pee. I mean, you can sit down, make yourself and allow yourself to pee. But in general, that muscle is being controlled by the autonomic nervous system. And the bladder lining is very friable or very sensitive. And you just have a little too much muscle tension in there, and the bladder lining looks different to the urologist with a scope inside the bladder. Very real physical things happen from this. So the problem is real. It's really in the body, but it's not caused by body tissue damage. And if there is tissue damage, like the lining of the bladder, it's because the nervous system is holding too much tension there. The attitude when you do the exercise, though, is oh, interesting. Look what my autonomic nervous system's doing that again. Oh, let me give it a reminder. We're okay. I'm going to give it a quick reminder by doing a quick little relaxation of the pelvic floor. Yeah. You get the message? Okay. I can't change it, though. I can't change it today. Nobody has direct control over this part of their brain. You can teach it. And what you want to teach it is, I'm safe right now. And every time you do a relaxation, you're safe. But if you do the relaxation exercise with the idea that, oh, I forgot to do it. This is the first time today. God, I was supposed to do it on the hour and I forgot to set my alarm today. Now you're doing it with, oh, I got this problem. You don't have a problem. You're just giving your brain messages of safety. And, oh, you forgot one day. So what? Start giving it messages of safety the next day.
I give people the example sometimes if they were going to go somewhere with one of their children and the child was all ornery, didn't want to go, and they're in the car and they're miserable. The energy in that car is awful. But if you go in the car and the child is like, oh, this is so fun, and everyone's happy and singing, the energy is so different. It's the same thing with this. It's the energy you do it with.
Yeah. And I think that is important.
It's all very important. And thank you for bringing up the idea that this is self-care. And if you're familiar with physical therapy, when you go to physical therapist, they give you a home exercise program. They call it the HEP. I stopped calling it HEP from the very beginning. I was like, this is not an HEP. I'm not giving you an exercise program. This is a self-care program. So that's what I actually call it. This is your self-care program, because I don't actually need to give exercises. I don't need to give a ton of exercises. It's mostly be aware of your breath, be aware of your pelvic floor, take some deep breaths, meditate, like go for a walk, like do the things that you find joy in, because that's when you're going to feel better. When you do these things, it tells your body and your brain that you are safe. If you enjoy being out with your girlfriends, then go out and be with your girlfriends. And then the other thing that you brought up too is the story behind it. And I will call that the judgment. Like, don't do these things with that level of judgment. Oh, I'm having that pain again. What did I do wrong? You didn't do anything wrong. You're experiencing a little bit more pain right now because of whatever happened before, but that's okay. What are you going to do about it right now? I think that's also very important to point out, is get rid of that judgment. Just whatever you're experiencing in the moment, it is what it is. What are you going to choose to do about it? And what you do about it is your form of self-care, so that you can feel safe in the moment. Because as you mentioned, that lizard part of our brain doesn't understand words and lectures and podcasts. It understands body language, body feelings. So what can you do? What do you need to do to tell that part of your brain that it's safe right now?
So we want to get away from judgment. And we also, I tell a lot of people who have maybe done a ton of psychoanalysis, I'm like, you want to get away from analysis. I mean, if you find a story that helps you understand, stories can be helpful, or as far as what happened to you. Sometimes I talk to, I was talking to my daughter once. She's now in her 20s, but it's when she was 17 or something, about how when from coming out of the womb, she seemed a little bit like this. She was, the crease in the sock bothered her, and the tag in the back of the shirt. He threw her mittens off the chairlift at 4 years old in 0-degree weather. I'm like, you can't lose. What the? Because there's something bugging them here. So, and then we'd get calls from the second grade. In second grade, we get calls from the school saying, it is snowing and sleeting outside, and your daughter's on the playground in flip-flops. And we're like, we didn't send her in flip-flops. She had them in her backpack because she can't wear shoes. So this whole thing, and I was talking to her at age 17-ish, so several years ago about, hey, you've always been a little bit like this. And I don't know if this is true, but I can tell you that while you were in utero, your mom's dad was dying of brain cancer. And she was really close to him and was caregiving. And then he died when you were 4 months old. And the next year, there's a lot of grief in your mom because she was close to him. I can just tell you that for the first 2 years of your brain development, those occurred in a hormonal milieu of cortisol and adrenaline. And maybe that's why you came out this way. I don't know. I don't think you have to go do an in-the-womb Reiki experience to figure it out. I'm just saying that based on what we know about brain development, that's likely, possible, but I don't think, so that kind of story can help somebody go, oh, okay, but it helps people see just how not your fault this is. Things happen and we can't even explain them all. And you don't have to go back and do let me figure out if that was it. That's not the important part. The important part is stepping back and understanding this is how brains work. We all have brain circuits that developed during maybe in utero, during the first year of our life, during our growing up. The human brain is born with only about 15% of the connections already synapsed together. The number of synapses we have in the brain at our time of birth is about 15% of what our total synapses are going to be. The neurons are there, they just haven't connected yet. And it takes a while to connect to all the rest of the brain. That's exact opposite of a horse, which is 85% of the neurons are connected at the time of birth, and it wires the other 15% over the first year of life. But this is why a horse can walk on day one. It's already wired to do that. The beauty of the human brain being less wired is it can learn a ton of stuff about its environment and adapt. And the brain adapts to its environment, whatever that is. So your brain is wiring together approximately 1 million new neuronal connections per minute between the ages of 0 and 7. And you are building a brain during that time. Whether you remember it or not, that's what's going on. So sometimes a story or hearing what happened to you when you were younger, or even remembering what was happening, can help you go, oh, I can see why I might be this, but not your fault. This is just what brains do, wired neurons in a specific way. Now, just because they're wired that way doesn't mean it's permanent, though. That's the great news about the new neuroscience and neuroplasticity. And that's not brand new neuroplasticity, but it's new since I'm so old that, I got taught that after you had a stroke, whatever you regained at 6 months, you're done. That's about, neurons regenerate in about 6 months. That is so not true. And I've seen it over and over again in my career, how not true it is. Somebody who's 5, 8 years out from their stroke, all of a sudden, sometimes all of a sudden, sometimes more gradual, gets their speech back that they had largely lost. Maybe they get 90% of it back, whatever. Things absolutely change. Your brain can rewire and reconnect neurons at any age. A little faster when you're 6 years old.
So true. We can always learn new things, right?
Wow.
So I know we could probably talk all day, right, about these things.
Yes, I have so many more questions, but time.
But I'm just wondering if there's one thing you'd want to end with or leave our audience with today, what that would be.
Yeah, let me leave you with something that we haven't talked about, but I think it's an important part for most of my patients, especially most of my patients with chronic pelvic pain. And I have a lot of men with chronic pelvic pain too. They've been labeled chronic prostatitis or pudendal neuralgia. I certainly see this in men, but it like other things, more common in women, but not specific to women though. But all of them, my experience is that regardless of gender, there is, I've spent this time, we've talked largely about habit loops that the brain develops and how it learns neural pathways. And it's just a learned neural pathway. And we want to unlearn that pathway. And we need to access the autonomic nervous system to do that. There are ways to do it. And the reason that I don't teach this in a 30-minute or 60-minute single lecture is because it takes longer than that to get at all this stuff. But the thing that we haven't talked about, though, I always like to say there are two things keeping the danger sensor part of your brain hypervigilant. One is just habit, experience, what it's been through in the past. It's running the same circuit it ran in the past to keep you safe, and we just want to untrain it to do that. But the second one is what I call under the hood stuff. This could be prior trauma that your body's holding on to. And that's, of course, now well accepted that bodies hold on to trauma ever since Bessel van der Kolk's, seminal book about mind-body medicine in 2014 came out, The Body Keeps the Score. And I don't even think he says the word mind-body in that book, but that's certainly what he's talking about. So this under the hood stuff could be prior trauma, could be emotions, maybe repressed emotions that you're not even aware of. But it doesn't have to be any emotion. Any emotion keeps me kind of on edge. Thoughts, my own negative self-talk, that also keeps me on edge. So I call these things under the hood things going on in the brain that keep the danger sensor like this. Regardless of how much you're working on the habit and giving messages of safety, if the background brain noise is giving messages of danger, then that keeps the brain in this hypervigilant state. So a second thing, besides these body-based exercises, and I have a lot more of them than just these two simple ones, but besides that, is getting out what's in. And this is a central precept of mind-body medicine, is getting out the stuff that's in us. How do you do that? So an example of an emotion that might be causing a problem, anger. And I see a lot of people who say, yeah, I'm angry, and I'm not repressing it either. I mean, I know I'm angry. I'm pissed off at that guy. I'm pissed off at this situation. But what am I going to do? Go punch him in the mouth? Go write a nasty email? That wouldn't help. If I wrote that email, do you know what would happen to my family dynamics? Nah, I'll keep it under the hood. You may be able to keep it under the hood. The autonomic nervous system knows you're angry. And when I'm angry, I'm hypervigilant. So this idea of getting out what's in, one simple way to get out what's in, and this is when you ask me what I want to end with, if you can fit this in somewhere maybe, but expressive writing. Super, super powerful. Expressive writing, you can do it for 2 minutes or 2 sentences. You can do it for 10 minutes, but once a day, you just write what you feel. And you don't analyze, you don't try to fix. You just write, what am I feeling right now? You write your feelings and your emotions. And it's simple stuff. It's not, it might be, I wonder what my husband meant when he said that at dinner last night. Or, I hope my son meeting with his boss goes okay. This is not a deep psycho dive into who damaged you at age 6.5. This is just a niggly crap going through your head all day long. You write it out, you get it on a piece of paper. And when you're done, you rip it up and you throw it away. And the ripping it up and throwing it away is a key part of the exercise because it takes the pressure off. This is not a term paper. Nobody's grading it. You're not even going to read it again. That's not the point. The point is not to psychoanalyze yourself. The point is to get out what's in. So very simple. I have some patients who say, well, you said I could start with 2 sentences, but by the time I write 2 sentences of my feelings, I got 3 pages. I got a lot of stuff going on up here. And I'm like, okay, write 3 pages. I'm the opposite. When I first did this exercise, I'm like, feelings and emotions? Oh, geez. This is going to be difficult for me. So I set my watch for 2 minutes. I set the timer on my watch for 2 minutes. I told myself I'm going to keep the pen moving. Even if I'm writing blah, 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 I'm going to keep it moving and write something. So I hit the button and I start writing. I'm supposed to write about feelings and emotions. Not really sure what I'm feeling right now. I actually wrote that. Now, when my wife hears me tell that story, she's like, how can you not know what you're feeling? Because she knows what she's feeling. And I'm like, I don't know, felt authentic to me. I'm fine. I'm always fine. But when I let the pen go, all right, I'm worried about my son. I think he's smoking too much pot. And I'm kind of pissed off at my wife for trying to start a business at age 57. What the hell is she thinking about? It's a ton of busy work. It's not going to make any money, and it's screwing up our weekends. And then I was done. I ripped it up, threw it away. I didn't solve either problem. I didn't try to solve either problem. I just put it on paper. I named it. Name it to tame it. In fact, everything I teach about, can you look at your body sensations? We're going towards the discomfort instead of running away from it. If you want to get out of the habit loop, you got to experience the sensation without the fear. And so we practice exercises of having body sensations without fear. If you want to get rid of the under the hood stuff, you don't run away from it. You don't keep it under your hood. You get it out. And this is one way on your own, people can get it out, is expressive writing. And don't put pressure on yourself. You're just writing to get out what's in, and then you're going to go on with your day. See what happens. A lot of people, a ton of people report back that, yeah, I just feel a little less tension on the days that I write. I have people who do it at bedtime. And they say, I started writing at bedtime. I was kind of worried it was going to bring up all my crap and it would make me, I wouldn't sleep as well. The exact opposite happened. It's like I put the crap over here and I stopped waking up at 2 a.m. I don't even know how that happened. So I encourage everyone to try that. It's a different thing that we spent most of this time talking about, but it can be a really useful, easy tool that people can practice on their own.
I love that. Thank you for sharing that. We have touched on bits and pieces of expressing how to express emotions and feelings in the past. And I don't remember if we've specifically talked about writing. We've always discussed like, oh, journaling is one, but thank you for laying out how simple it can be. Just spend 2 minutes. And as you mentioned, how the process can go from, you can see the switch in your example from conscious mind. I don't know what I need to be doing right now, to the subconscious coming through, I'm worried about. And I think that's just beautiful that you experience that. And it also gives real life example of how it might be for someone who has a more difficult time tapping into their emotions and their feelings. So thank you for sharing that. Would you share where people can find you as well?
Yeah, my website is called bouldermindbodymedicine.com. And I see people for individual appointments, but I have to say I'm just so evangelistic about the class. And I do have a lot of people who just take the class. That you don't need to see me to do that. That's very cost effective, and 4 weekly sessions with a group. I do it every month. Super powerful way to learn. I love the class because I say we're leveraging the healing power of community and connection. Because it's not group therapy. We're not sharing, but something about learning these tools with other people and seeing, oh, it normalizes it. You see 20 other people kind of all with and they're intelligent people asking intelligent questions. You're like, okay, wait a minute, I'm not weird here. So I love that part of it. It just, the normalization part, I just think something magic sometimes happens when you learn this stuff in a group setting with a lot of Q&A time and actually practicing exercises and then asking what happened there and hearing what happened when somebody did that. So yeah, you can find me at bouldermindbodymedicine.com. Thanks for asking.
Thank you so much for being here today to share all your knowledge and expertise and for giving our audience some practical tools that they can use throughout their healing journey. So thank you so much. We appreciate your time.
Yeah, I appreciate you guys, what you're doing. Thanks a lot.
Thank you. Thank you. And enjoy the rest of your day.
All right, you guys too.
If you'd like to leave us a message or ask a question, please check the show notes with the link so you can reach us directly, or email us at beyondthepelvis@gmail.com.